Welcome, everyone. Welcome, everyone. Thank you for joining us tonight for the Janssen Supply Chain Recruiting event. It is surefire, I tell you, power, just the number of people that we have on the call who are representing Janssen and Johnson & Johnson, who are here to really give you some advice, give you a look in the day of their life and what they have going on with a brand that's as dynamic as Janssen and Johnson & Johnson. We've worked with them before as an HBCU CONNECT, partner, and we have had some fantastic experiences. We know this one will be all the same. To our candidates, make sure you utilize that chat feature. That's how you will be interacting. Make sure you're letting us know who you are. Let us know which HBCU you attended. If you've had some experience in pharma before, put that in the chat too. We want the energy, and our energy will really be reflective of how much you bring. So let us know who you are. Use that chat feature, and we're excited about having a wonderful, wonderful evening tonight. All right. So with that being said, some of our ground rules. This is a confidential and proprietary event, so no photographs permitted. Content's not to be shared outside this meeting, and it's not for promotional use. This is for employment and recruitment purposes only. Please do not be that candidate. You take a snapshot and you send it out, and 2 months from now, 3 months from now, you're up for an opportunity to work for Janssen or Johnson & Johnson, and something comes up where you did not follow the rules and they have to let you go, right? So let's follow the rules up front, and let's make it a great evening. My name is Larry Jemison. I am a Vice President of Business Development with HBCU Connect. I will be your facilitator tonight. We have worked diligently with the J&J team to host this event and put this on for you. It's really a great opportunity to learn more about the Johnson & Johnson companies as well as Janssen, and it's really your opportunity to shine. So we'll have a great event. As you can see from our agenda here, we will stick tight to this agenda. We'll stick close to the agenda, but we have some dynamic people who are going to speak with you today. So we'll have an overview. We'll have a little bit more information about the Janssen companies. We'll have a panel discussion, breakout rooms, which will give you further information on those breakouts and how they'll work, and then closing remarks and next steps. Okay, so we will be close to time, so let's get going. At this point, I want to introduce somebody who is just a dynamic person. Dapo is Vice President of Janssen Supply Chain, and in this role, she's responsible for shaping the long-term vision, strategic direction, and delivery of the end-to-end supply chain for Janssen. She's not new to leadership. Prior to this, she served as technical operations and supply chain strategy, where she was accountable for accelerating the delivery of supply chain strategy and maximizing the collective impact of environmental health and safety, engineering, property services, and so on and so forth. Dapo is interesting in the fact that she has a broad business background, but also a technical background. She's a pharmacist and has a graduate of the School of Pharmacy, and is a graduate of the School of Pharmacy at the University of Wales in the United Kingdom. She's held a variety of senior technical and supply chain leadership roles. She's even served as the Chief Procurement Officer at a global pharmaceutical company known as AstraZeneca. Dapo was included in the 2019 Pharma Voice 100, which is a list of influential and inspirational leaders from the life sciences industry. At this point, we want to bring on Ms. Dapo Ajayi, who's nothing less than just wonderful. Dapo, are you there with us tonight?
I am. So good evening, everybody, and a very warm welcome to this virtual networking event.
It's so good to see you. We're so glad to have you, and I hope everyone on the line is as excited about it as I am.
Great. Well, let me start. You've done a really nice introduction of who I am, but I kind of also just want to kind of share with you that you will see another picture there, which is my partner in crime. We're joined at the hip, Kimberly Lowndes Foster, who also leads the advanced therapy supply chain, and the two of us together lead the whole of the Janssen global end-to-end supply chain. Now, I'm actually in Europe this week, and it is pretty late. And actually, I am using the Zoom touch-up feature here. But I was determined to join live because this is such a fantastic opportunity for me to welcome and connect, albeit briefly, with talented HBCU alumni And for me, I felt this was just too good an opportunity to miss. Connect events like this are extremely important for us as J&J leaders. Why? Because it's the opportunity for us to connect with and frankly attract talented individuals like yourselves with us. And I have a specific focus on attracting the next generation of supply chain leaders. Now, you're going to hear a lot about Janssen and what we're about, how we operate, our culture, our values. But I also want you to leave the session today and be aware of the investment that we are prepared to make to create opportunities and to enable professional growth and success. So let me start by telling you a little bit more about myself. I mean, I think in the opening talked about my background being a pharmacist. I guess my accent is a bit of a giveaway that I studied in the UK. And as was said, I spent my whole career in the pharmaceutical industry in different companies. And I've worked in R&D, I've worked in supply chain, I've worked in commercial functions. But my passion is the supply chain. And like you, I have had choices. I've had choices throughout my career. And just over 5 years ago, I made the choice to join J&J. So what attracted me to J&J? Well, I'm a big believer that people attract people. So I was initially attracted by the conversations that I had with leaders from across the business. What came through to me was the passion that they showed for the patient, the strength of our product portfolio, the kind of breakthrough science and innovation that was taking place. But also, I was attracted by the commitment to people development. And frankly, I smelt the culture. And the culture in J&J is truly defined by our credo. Our credo is our North Star and defines across 4 paragraphs our commitments to patients and customers, to our employees. And with our employees, there's a real focus on our commitment to providing an inclusive work environment where each person must be considered as an individual and feel they can bring their authentic selves into work every day. The 3rd paragraph defines our commitment to the communities in which we work and the environment. And the 4th paragraph defines our commitments to stakeholders. Our credo is in our DNA and has served us well. And in fact, this year, we're proud to be celebrating the 80 years of our credo. So there's one thing to be attracted by a company, right? I always say that's the courting. Then there's the actually joining the company. And I would say that's the kind of, that's getting married, right? So what's been my 5 years of marriage? What's been my 5 years of experience in terms of working in J&J? Well, I'll start by saying that I joined J&J not for a job, but for a career. And in the 5 years, I have had the opportunity to work with exceptional people. I've been involved in truly leading edge technology and innovation. I've been involved in launching some breakthrough products. And J&J has delivered on its commitment to supporting my career growth. I've had 3 roles in the last 5 years, and I'm now in the role that I aspired to when I joined. Now, as I said to you, I have a passion for supply chain. Why do I love supply chain? For me, it provides the opportunity to really leverage and grow my technical expertise on leading edge manufacturing processes. It enables me to work cross-functionally, to work with my colleagues in R&D on process and product development, on manufacturing science and technology, and being involved in bringing through the next generation of products that are going to serve our patients. But equally, our supply chain also works extremely closely with the commercial functions. So it's given me the opportunity also to evolve and build my commercial acumen. And since such a big part of supply chain is manufacturing, it's a wonderful opportunity to grow as a people leader. All of this in a pharmaceutical industry setting is done in the knowledge that everything that we do every day is about delivering life-saving medicines and treatments to patients around the globe. And that we're working in an industry that is all about innovation. It's all about looking at ways in which we can rapidly evolve to address unmet patient needs. So I'm going to hand over to you, to Kimberly, my colleague, in a moment. But before I do so, I want to once again say thank you for choosing to dedicate a couple of hours of your time to learn about J&J, to learn about what we do. And I would like to extend the offer of an opportunity to visit us, our manufacturing facilities, our offices, so that you can get a sense of our culture, you can learn more about what we do. So enjoy the rest of the event. And I'm really hopeful that I have the opportunity to meet some of you at some point in the future. So I'll hand over now, I think, to the video of my colleague, Kimberly Lowndes-Foster.
Hi, I'm Kimberly Lowndes-Foster, head of our Advanced Therapy Supply Chain, and I'm really excited to kick off our HBCU CONNECT event. I joined J&J earlier this year, and in a short amount of time, I'm inspired by both the vision and how we live out our values across our workforce, really with a high focus on both inclusion and reflecting the diverse perspectives of the patients we serve. I lead our advanced therapy supply chain, where we work on cutting edge technologies such as cell and gene therapy, and we're really working to accelerate bringing life-changing treatments to our patients. In bringing these innovations to patients, we use our size for good. Our teams are global and come from so many diverse backgrounds. Our credo, which serves as our guiding principle, says that we must respect our employees' diversity and dignity and recognize their merit. We are so committed to these and also ensuring that we provide an equal opportunity for employment advancement and truly nurturing the workforce of the future. I have seen us live this out every day as we strive to ensure our workplace is inclusive and we achieve our responsibilities to our patients. I echo Dapo's sentiment and encourage you to take a tour of our office or our manufacturing facilities and really learn more about what we do. I'm excited and hopeful to meet some of you over time. And today, I really hope you enjoy the meeting. Connect with as many people as you can, ask questions, and we are extremely proud of what we do here. And I hope you have a great experience today.
Wow, Dapo, thank you. For those what you just heard was amazing. Dapo said that she's over in Europe right now. So that means it's just after midnight there, but her commitment to being here tonight is unyielding. And we want to thank her for that. Kimberly, thank you for your kind words as well. The leadership is just phenomenal. Wow. With that being said, we're going to keep this ball rolling. Another high-powered executive, Miss Robin Kumolui, who I've had the pleasure of meeting earlier on in the call, another dynamic executive from Janssen and Johnson. Robin, are you there with us?
I am. Good evening, everyone.
Good evening. Please give us a background on you, Miss Robin, and what you want to share with us tonight.
Excellent, thank you. Well, again, good evening, everyone. I'm hoping that you're very inspired by the messages that you heard from both Dapo and Kimberly. This really is an exciting place to work. I am Robin Kumolui. I'm the Chief Quality Officer for Janssen Pharmaceutical. I've been with the company for about 7 years now. However, I've been in the industry for 37 years. I've worked in all types of pharmaceutical, consumer products, mainly in quality and compliance, and some in R&D. Interestingly enough, when I joined the company 7 years ago, I wasn't really looking for a job, but I had met some folks networking and they started talking to me about J&J, and I sent my CV in anyway. And I know you've heard this over and over from my two colleagues, but I have to tell you, the reason that I joined J&J is because of the Credo. We truly do live that out every day, in and out. And I'll tell you, when I first start talking to people, I said, what is this Credo? Is it real? You go to many companies, you see visions, you see missions, you see slogans on the wall. But I have to tell you, the Credo is real, and everything we do is guided about it. So I'd like to give you more information about Johnson & Johnson. I'm very excited to provide that overview of the full breadth and power of J&J, and then specifically get into who we are as Janssen, and more specifically, who we are as supply chain. So again, it all starts with our Credo. Our Credo is a collection of values that challenge us to put the needs and well-being of the people we serve first. It was a breakthrough idea when it was written in 1943, and our Credo is as relevant today as it was then. It guides us in how we do things at work and in the communities we serve. Because our Credo is foundational for everything we do, every solution we deliver, and every person we hire, it's important to see how it intersects with every facet of our company and the people we serve, our customers and patients, employees, communities, and shareholders. Next slide, please. All right. So although we hope that you know us based on your personal experience with us, our size and breadth are more significant than you might have imagined. Johnson & Johnson is the world's largest and most broadly based healthcare company with a vast array of capabilities that have been honed over more than 136 years. At Johnson & Johnson, our purpose is to blend heart, science, ingenuity to profoundly change the trajectory of health for humanity. Next slide, please. Our global headquarters, as you may know, is located in New Brunswick, New Jersey. Today, Johnson & Johnson is over 130 employees strong, operating in 60 countries all over the world. Together, we stand as committed and compassionate partners throughout the journey of life. And the breadth of our business segments is unmatched. Today, we are newly positioned as two-sector model, med tech and pharmaceuticals. The separation of our consumer segment, formally spun off as Kenvue, enhances our focus on pharmaceutical and med tech research and development to deliver innovative and differentiated health outcomes. We remain a global leader in healthcare, focused on major unmet medical needs and materially advancing standard of care through biopharmaceutical and medical device innovations and technology. Next slide, please. We are constantly focused on serving our patients and making groundbreaking discoveries. And for efforts, we have been recognized in many forums. There are about a billion people who use our products every day. 18 of our medicines are on the World Health Organization's essential medicine list. We ranked second on the 2022 Access to Medicine Index. We've been named for more than 30 years on Fortune's Change the World list. This is every year since the list was created. Our commitment to employees are constantly being recognized by organizations like Working Mothers. We're a AAA rated company, which shows that we are impeccably and have good financial strength. And we demonstrate dividend increase for the last 58 years consecutively. We're proud of our accomplishments, and we feel that this speaks to how we deliver for our patients. Next slide, please. So now let's focus on Janssen Pharmaceutical operations a bit. We are focused on 6 therapeutical areas: immunology, cardiovascular and metabolic disease, pulmonary hypertension, infectious diseases and vaccines, neuroscience, and oncology. From vaccines to cancer treatments, the work we do has the power to impact the lives of millions and billions of people around the world. But it's not just the scientists in the lab who are contributing. Each of our teams play a critical role in getting new drugs to those that need them. Our supply chain organization manufactures and delivers our wide range of products to those that need them when they need them. So with this, next slide. All right, with this, I'd like to play a short video to share with you our promise to the world.
At Janssen, we are called to rise each morning and achieve today what last night seemed unimaginable. We are called to blaze paths where others fear to go, to unravel and repair the very code of life, to treat, intercept, prevent, and cure. We are called to open our doors to collaboration and our arms to the needs of each patient, so that what works in our labs also works in their lives. We are called to advance how medicines are made and made accessible around the world. We are Janssen, the pharmaceutical companies of Johnson & Johnson, and we are heeding the call. Bravely and boldly, fighting sickness with science, improving access with ingenuity, and healing hopelessness with heart, until the world's most daunting diseases are found only in the pages of history books. At Janssen, we're creating a future where disease is a thing of the past.
All right, well, I hope you can see our commitment through that short video. I will say we have a remarkable track record of productivity and momentum, with 22 new medicines since 2011 and 6 just since 2022, with many of these being first and best-in-class medicines. The impact of the medicines we deliver extends beyond the patient and helps to transform the lives of their families that support them. Our products help to deliver improved quality of life and real hope for individuals suffering from a wide range of diseases. Next slide, please. J&J has one of the strongest supply chains, ensuring that people around the world continue to receive access to the products they need to stay safe and healthy. We accelerate new levels of innovation in products, services, and experiences for the doctors, nurses, patients, and customers we serve. We build foundational capabilities in key areas that enable us to harness new levels of agility and get ahead of changing needs. This was put to the test just recently during the pandemic, when our team showed up, manufactured, and delivered products for patients that were waiting. The power of our supply chain is strong and powered most importantly by our people. We manage over 1,000 suppliers, process over 1.4 million orders per year, and partner with over 100 external sites to deliver to our patients. This leads us to our ultimate vision. Next slide, please. At Janssen, we never stop creating a future where disease is a thing of the past. Our commitment to deliver on our promise never stops, and we will never stop caring, developing, testing, and putting the health of humanity before our bottom line. And with that, I hope you get a good flavor for who we are as Johnson & Johnson and our commitment to our patients that we serve around the world. Thank you.
Ms. Kumoluyi, thank you so much for your time and those kind words and giving us that information. I think the background was incredible, and hopefully our candidates got a lot out of it. I think they will. Thank you so much. At this point, we're going to move on to our next presenter, a person that we got to meet earlier on before the call, another dynamic executive from Janssen. They're going to give us a little bit more background about the people behind Janssen Pharmaceutical. So with that, we're going to turn it over to Mr. Cecil Johnson. Mr. Johnson, are you there with us?
I'm good, Larry. I am here. Thank you. Please just call me Cecil. That's
You
fine.
got it. Thank you.
Well, look, I'm excited to be here. Good evening, everyone. Good afternoon. My name is Cecil Johnson, and I'm the head of diversity, equity, and inclusion globally for the 46,000 committed employees in our pharmaceuticals, research and development, global external innovation organizations. And just to let you know, my 20 plus years here at Johnson & Johnson contains in its sales management, learning and development, leadership development, global talent management, and now the privilege to lead diversity, equity, and inclusion in this pharmaceutical organization. So I've had 20 years plus of career experiences, not jobs, that have allowed me to grow, develop, and make an impact. But that impact was built on a foundation that prepared me and demanded that I succeed. So Larry, if you go to the all-important next slide. I am a proud alum of Hampton University, the standard of excellence. And then look, I'm not going to say that it's the best HBCU, but you know, I'm not going to say that, but you know. But again, regardless of what HBCU you went to, and they are all fine institutions, here's what's generally true, I think, for all of us, that while some students go to schools and they have a transactional experience with each other, we have a relationship with our schools. We love our schools. And we go back to them at different times of the year for homecoming and go in our yards, and we fall in love over and over again with our schools. And I share that with you because at J&J, it's important that you look for and think of a company that you can build a relationship with and examine how our values, beliefs, and principles align with yours so that you can build that relationship. So I think it's important that you find a way that you can be fulfilled, that you can be excited, and that you can feel that you can be yourself, an authentic self within an organization. If you'll go to the next slide. So who are we? We are a community of people who believe that what we do is a calling, not just a business. You heard consistently from Dapo, from Robin, is that we have careers and experiences, not just jobs. So the 46,000 employees that work at Janssen are privileged to play a role in helping the generations of people live healthier lives by delivering innovative medicines, products, and solutions. When I was sitting where you are, when I started with the company years ago, our world was very different. DEI in the world was not necessarily a priority the way it is now. The resources necessarily weren't there to support how diversity, equity, and inclusion can impact companies. And in some ways, it was seen as an obligation versus a business imperative. You know, like, okay, let's do this to make people happy. And for some companies, it may still seem that way. But in my 20 plus years at Johnson & Johnson, I've seen it as a priority each of those years, and I've only seen it grow. And it continues to grow day after day. And the reason why it grows is something that Robin talked about, something that Dapo talked about. And if you go to the next slide, it starts with our credo. Many of you have probably seen the report, read the article, seen headlines around millennials and Gen Z workers are holding companies accountable to commitments around diversity, equity, and inclusion. And as Robin discussed, our credo is in stone in our world headquarters for anyone to come in, to look at it, to touch it, to see it, and to hold us accountable to it. So as Johnson & Johnson, we're guided by our credo. If you know anything about us, it guides our decisions that we make on a day-to-day basis. And it outlines our commitment to patients, consumers, professionals, to our employees, our communities, as well as our shareholders. But it also challenges us to put the needs and well-being of the people we serve first. It also challenges us to prioritize diversity, equity, and inclusion. I believe Dapo signaled this when she said, directly from the credo, we must provide an inclusive work environment where each person must be considered as an individual. We must respect their dignity, we must respect their diversity, and recognize their merit. And we accomplish this through our strategy, which is on the next slide. So at J&J, we prioritize diversity, equity, and inclusion as a business imperative. Like any business imperative, you need a strategy. So if you look at the top of the screen, our vision, it's be yourself, change the world. And that's about how we create the space as an organization for you to be you and make a difference. Our definition of diversity, equity, and inclusion is we all belong. Let's focus on you being you and still being able to be a full participant and part of this organization through belonging. And then our DEI mission is to ensure that diversity, equity, and inclusion is how we work, and it's not separate from work. So our strategy, which is evidence-based, is informed by data and insights globally. And it helps us prioritize and how we invest our resources so that we can get to the need that's greatest. And through these insights, here's what we know. We know that diversity means something different depending on where you are in the world, but the desire to belong is universal. When our employees show up as their authentic selves, they're empowered to advocate for themselves and their communities. Our potential for success will multiply. And what is surprising to know that data shows that bringing diverse perspectives into the workplace drives innovation. Deloitte study shows that diverse and inclusive companies are 8 times more likely to achieve better business outcomes, 6 times more likely to be innovative and agile, and twice as likely to meet or exceed their financial goals. So each of the pillars that you see in the strategy make up the interconnected way in which we foster a culture of belonging, accelerate equity access and innovation to deliver new health solutions via our diverse workforce to the people who count on us around the world, which means that we have to have, and we have, a sense of urgency to make an impact. And if you go to the next slide, Larry, it's our race to health equity. Just a little bit about me. I grew up in Philadelphia, and my dad was a pharmacist. And I used to sweep the floors in the store in North Philadelphia and watch patients come in and out and hear him counsel them from over the counter about their meds and why they were important. And I would overhear them saying, that wasn't explained to me when I was at the doctor's office. And as a kid, I would ask him, so why not? Like, why are they saying that? And he said to me, some patients get treated different. And I knew that I didn't necessarily want to be a pharmacist, but I knew that I wanted to make an impact somewhere in this space. And our race to health equity is just that, a race and an urgency to create change, to address where racism has an impact on the quality of care and access to the care. And we are closing the racial health gap. If you go to the next slide, Larry, we launched this effort in November of 2020. So ORTHE, or Our Race to Health Equity, is a $100 million enterprise-wide initiative focused on closing the racial health gap. So what started as a $100 million commitment driven by a moment is turned to a movement and a catalyst for change. ORTHE is more than a financial commitment for us. It's our innovative strategic approach to making DEI work to drive in greater social impact and influence systemic change. We're embedding racial health equity mindset across our enterprise and skill set across our enterprise, and leveraging our scale and size to really create change across the healthcare industry. J&J is committed to changing the culture of healthcare so that it meets the needs of all communities. It's really important that we signal that the launch of Orthy, our Race and Health Equity, created a unifying and collaborative approach to amplify our collective racial health efforts. We're working to change the culture of healthcare and really support solutions that systemically address racial health equities. And what you see on the screen is 4 key areas. 1, community health capacity building. We want to make sure that we're expanding access to affordable community-central care, to making the investments in community health centers and community health spaces. We also want to make sure that our commitment to the community and engagement education is there. We want to empower patients to own their own health and increase their health literacy by giving them tools and resources. We also want to make sure that there's culturally competent care. We want to increase the racial and ethnic diversity of the healthcare talent pipeline and workforce so that we can promote an equitable point of care experience for all patients of color. And then, of course, when it comes to research, we want to make sure that the research is inclusive and that clinical trials are representative. So we want to increase access to clinical trials through diverse site selection and patient recruitment, as well as incorporating equity into end-to-end therapy and device design. And if you look at the next slide, it's going to show you various therapeutic areas all across our Janssen organization where we are making these commitments to health equity and that we're making an impact and changing the system to make an impact. Lastly, I want to talk about you as a talent and our talent in Johnson & Johnson, which is the next slide. We empower our employees and encourage our employees to use their talent and skills for good in various ways where they can use them to impact communities, locally and globally. As a company, we also have different experiences where our colleagues can use their skills, but also we have volunteer leave that can span anywhere from 16 hours to 80 hours. And also a global pro bono program where you can use your talent and expertise to impact areas needed globally. So finally, I want to end where I began. So for us, diversity, equity, inclusion is a strategic business imperative. It's a part of how we work. And as I began, I said, it's important that you ask yourself, is Johnson & Johnson the type of organization that you want to build a relationship with? We hope so, and we'd love to have you be a part of our yard. With that, I want to transition back to you, Larry.
Cecil, thank you so much. Your commitment and dedication comes out. We can hear it in your words. Your passion for DEI, your passion for making sure that the Johnson companies are moving forward. And we just appreciate you. So thank you.
Thank you.
And from a Tuskegee graduate, looking at your resume, you only have one imperfection, and that's the Hampton. But I mean, other than that, you have a flawless resume, and we're so happy that you're here with us today.
I appreciate that, Larry. I appreciate that.
No, all jokes aside, thank you for your kind words. I think our candidates probably got as much out of that as I did. It was very informative, and we want to thank you again. At this point, we're going to go towards our panel discussion. We have some leaders from J&J who have committed to share some tidbits with us, some information with us. And what we'll do is we'll have them introduce themselves as they are on our slide here in this order. And we'll start with Nima, and we'll have them do a brief introduction, and then we'll ask them some questions. So Nima, are you here with us?
Yes, Larry, thank you. What a pleasure to be here with such amazing talent and wonderful people from J&J joining me. So thank you for inviting me. My name is Nima Subramanian, and I lead the North America portion of our biologics manufacturing network. And I've had the pleasure of being with J&J for 15 years, both on the medtech side and then on the pharma side. So really looking forward to this panel discussion.
Wonderful. Thank you for being here. Tamara, are you here with us, or should we call you Tam? You kind of gave us a little permission earlier, but I didn't want to do that without getting your permission.
No worries. Thank you. Hi, everyone. So glad to be here. I'm Tam Sanin, and I'm a deployment lead on our advanced customer capabilities team. What exactly does that mean? It basically means I get to shape and enable our customer experience strategy. Been at J&J for 2 years. I've worked across supply chain and commercial, and prior to that, I had 20 years in the United States Navy. Glad to be here, and such a pleasure. Thank you.
Thank you, Tam. Pete Goodrich. Pete, You there?
I am. So thank you, everybody. I appreciate the opportunity to come spend a couple hours here with you this evening. And actually just impressed with our other J&J colleagues around the call tonight, inspiring, just sitting here listening to it kind of played back. But I am a general manager for one of our facilities outside of Philadelphia in a little area called Melbourne, Pennsylvania. And we're a biologics facility, around 300 employees that are working 24/7 around the clock, meeting patient needs around the world. I've been with J&J a little over 12 years. I also, like Tam, transitioned out of the U.S. Army about 12, 13 years ago. So I look forward to trying to answer some of your questions this evening.
Thank you, Pete. We look forward to talking to you. And also, last but not least, Jaggy. How you doing, Jaggy? You there?
I am. Hi, and thank you so much for having me. So I'm Jaggy Patel, and I am actually in the middle of a transition into a new role as part of my development plan. But I was previously the Senior Director in Value Chain Management, leading product strategy for our established brands, which is the Value Optimizer and late stage portfolios. And as part of my development plan, I am now moving into a new role as the Senior Director of Small Molecule Platform Planning, where I'll be leading the planning organization. I have been with J&J for about 11 years, and I also came in as an experienced hire.
Wonderful. Thank you, Jaggy. We're so glad to have you tonight. Thank you for joining us.
Happy to be here.
Perfect. So, and that's a great smile. You look like you're enjoying it. Wonderful. So at this point, we did have a question before we go to our panelist questions. We did have a question that we want to pose to Ms. Kimberly Lowndes Foster, who we heard from earlier, the Vice President of Advanced Therapies Supply Chain. And that question is, at J&J, how do you feel you can be yourself as a leader in your organization? Kimberly, what kind of culture do you want to build for your teams?
That is a great question. So first of all, I've only been at J&J a few months, 8 months, almost a year. So it's been great coming in and actually establishing myself as a leader within a company, building a team, but also being part of various teams where I've been included. And so there's a natural part of our DNA that just pulls people in, and it's a natural inclusion. So I've been very fortunate and excited about that. I think from a leadership perspective, I also want to create an environment to drive both inclusion, get diversity of perspective, diversity of people on my teams. And there's a very deliberate effort to do that from a leader's perspective, my own, and then I can see it play out. I've seen it play out in the last several months where when we're recruiting, we're ensuring that we have diversity on our slates. When we're building teams, we're making sure cross-functionally we have diversity of thought. We're challenging the way we approach things. And for me, that's how, this culture allows you to be your true authentic self every day. And that's the culture I want to build on my teams. And that's the culture of the team I actually joined. So I'm very excited that that's been the experience here at J&J, and hopefully you find that as you explore us as a future employer.
Well, thank you, Kimberly. We definitely feel your commitment to building teams that are diverse and ready to carry Johnson & Johnson forward. So thank you for sharing those words. I think we'll go back with a question. So Nima, are you ready?
Yes, I am.
Wonderful. Nima, what do you like most about the employee culture and work environment at Johnson & Johnson?
Thank you for that question. I think when I look back, maybe 15 years from now, back when I joined J&J, I will tell you a story about how I was attracted to J&J. For those of you who chatted, I saw that many of you come from an engineering or science background, and I'm an engineer by education. I'm a mechanical engineer, and I was working at Boeing at that point in time. And as you can imagine, as a Mechie, this is like a dream job, like building these giant flying machines. But around that time, my mom was diagnosed with an autoimmune condition. And it really got me thinking, what is the purpose of what I'm doing? And how can I get involved with companies that do things that help people like my mom. And at that point in time, I reached out to several pharma companies and started talking to them. But there was something special about J&J. I think every leader you heard today spoke about the credo and the 4 paragraphs and how they guide every decision you make. And you see that come through in every interaction you have with the leader at J&J. And I'll go even further to say this, right? The credo is not a static document. While Cecil mentioned that this is something that is carved in stone, but the essence of it remains the same, but there are explicit elements that are added to make sure that we are in keeping with the times. One example I'll give is in 1987, they added the word fathers and not just mothers to the first paragraph, kind of calling it out that, you know, we want to support the family structure and make sure that both fathers and mothers are supported as J&J, right? It also kind of implicitly spoke about work-life balance, how we can be mindful of our employees and how our employees can fulfill their, not just their family, but other personal responsibilities. Another aspect of where the credo changed, and I think really hit home for me, was in 2018. Again, we made a change. Several of the leaders spoke about how we explicitly called out respect to the people and diversity and dignity to the people working for us. So again, it's a static document in terms of its essence, but it keeps evolving and adapting to make sure that every person who joins J&J feels included and is continuing to make the impact this company has made for so many years, right? Now moving on from the credo, you asked me a question about culture, and I know Kimberly just spoke about 2 elements of the culture, and maybe I'll add on to what she spoke about. One, she spoke about a deliberate attempt to increase diversity in J&J, right? So a few years ago, and there's this report called the Health for Humanity report, and it has these goals that J&J is to achieve by 2025. And one of those goals is that at least have 36% ethnic or racial diversity in management positions. And I'm really happy to say that we exceeded that goal at this point in time. So again, it goes to show that while it may be implicit, we're also explicitly taking actions to make sure that diversity and inclusion is top and center of every leader's mind and every person and employee's mind in J&J. The other one Kimberly spoke about was natural inclusion. Again, we don't take inclusion for granted. While it comes naturally to many of us, I think in J&J we make a deliberate attempt to continue to strengthen the inclusive mindset, right? We build on our cultural competencies. We work on immersive kind of dialogues and series to ensure that our inclusion muscles are kept, not just the conscious ones, but the biases are eliminated, right? Then one of my favorites more recently has been this thing called the brave culture conversations, where you include people and have a conversation, really open dialogue about things at the cost of health inequity. I think Cecil mentioned a couple of examples when he lived in Philly. And I can say, and I spoke about my mom, she didn't have access to many of the medicines for various reasons, and how J&J as a company is working to make that access better. So these are some of the elements. Of course, Cecil spoke about ortho as well, but many, many great things happening in J&J makes me feel like this culture is one that makes sure that we are putting all the elements of the credo first and continuing to support employees and the talent that comes into J&J. Thank you for that question.
Nima, thank you. While you were speaking, there was a follow-up question that came in from one of our candidates, and they wanted to know, from an engineering background, how difficult was it for you to, I guess, get up to speed at J&J, or maybe moving more into a pharma role? How long did it take you to get up to speed?
Excellent question, and a true engineering question, right? There's always a mindset to solve problems. So I think when I joined J&J, I have to say this wonderful community of people in J&J really work to make sure that you're set up for success. I know several of our colleagues here are in the HR department, and I can tell you that when I came in, there was a really good buddy system that was put in place so that I could jump right into the organization and learn from people whom I'm working with as to what were the key people to reach out to, because not always is it a book or is something you read, but a person who may be able to help you. So I think there were a culture of that buddy system, but also I'm going to call out one of my fellow attendees today, Jim Green, whom I work very closely with in what we call as the culture team, in trying to build a inclusion workbook or inclusion playbook that really, if any new employee comes in to J&J, they have this ready for them so they can navigate the very complex world of J&J. And to answer it in the last bit I'll answer is I did join the medtech side. So being a mechanical engineer was a little bit of an easier entry point, but moving to pharma, I dreaded that transition, right? Thought, oh my God, I have no background in chemical engineering or material science. How am I going to be able to do this, right? And again, the J&J network is so powerful that they literally pull you up by your shoestrings and make you get to where you need to be. And several of those people are on this call who have helped me through my career. So thank you for that question.
Nima, thank you. Thank you for your response. I think that that ties directly to the question that was in the chat, and I think you're going to help a lot of people with that response. So thank you. Next up, Pete, are you there?
I am still here.
We have a question for you, Pete.
All right.
Take us through your career journey. How easy or difficult is it to move around the different segments of the company?
Yeah, it's actually gotten much easier, I think, over the last 5 to 10 years. And I started I actually left the U.S. Army 12 or 13 years ago, and in my mind, I thought I would move to a company, right, and I would just settle down. In the Army, you tend to move around every 2 or 3 years to different bases and locations, and so I thought, I'll move to Janssen. I'll pick a nice location and I'll settle down. But actually, after 3 or 4 years and working on my development plan, as Jackie touched about, we're very diligent about a process in J&J, and we call it our 5 conversations. And we really work to make sure that we're giving feedback on how people are performing, but we're also trying to plan forward and try to meet the needs of each individual in terms of how they want to continue to maximize their potential and grow and meet their desires. But for me, I really wanted to get additional. I started in our planning organization, production planning organization, and I wanted bigger and bigger challenges. And ultimately, to do that, I needed to move to Europe. And so J&J Janssen was generous enough to move not only myself but my family, so my wife and 2 girls, to Europe. And I moved to Belgium, actually, where Janssen started, where Dr. Paul Janssen started the business. Right, he had a great phrase: "Patients are waiting." And so I moved to a large facility there, working in our small molecule business and really working on a number of APIs and complexities. And so I got this great challenge. I moved back 3 years later, back into the US, just in time to get back in the US before the pandemic started. And I was kind of looking around for my next opportunities, and they said, "Hey, I've been doing planning for a long time. We've got this new challenge coming in. We're trying to move into the vaccine space so we can help out with COVID vaccine." And they said, "Hey, would you do the planning for this?" And incredible unmet need, right? Patients are definitely waiting. And so was able to step into that, and I built the team. We put the network together, in 18 months, incredible heavy lift, but was really able to be there for a challenge. And now, most recently, I've been able to move to a site outside Philadelphia, 300 passionate people that all work 24/7 through the pandemic, so people could really have what they needed. But maybe just, listening to others, I'll just round out with a couple of things. I sat there 13 or 14 years ago listening to different companies, and I can tell you, as I saw some of the pictures that we showed in the clips in the movies, I know those faces, I've met those people. What we do is real. And, it's not just lip service. I think what the value was and what I looked for, right, was how would I know that I could have impact and value? And we have impact and value, not only getting to patients, but I think our leaders in J&J really care about developing people and trying to move them forward in the organization. And I think it's really a community of, 100,000+ employees around the world that I know I can pick up the phone, whether I'm talking to a scientist, an engineer, it doesn't matter. People are always there to help. So it is a great family type atmosphere. And, hopefully you can find the same if you can join us in the future. So.
Yeah, definitely. Pete, thank you for your response. And also thank you for your service. We really appreciate you.
No problem. Thank you.
Thank you. Jackie, we still have you?
I'm here.
Perfect. All right. So we have a question for you. And that question is leadership committed to diversity in the organization? And how do they express that commitment throughout the organization?
Absolutely. So here at J&J, we often say that our people are our greatest assets. And we really mean that. Each employee brings different types of skills and backgrounds, unique set of experiences, thinking styles, and much, much more that creates this richness to our company. And it also allows us to serve our diverse customer base quite well. So when it comes to diversity, I'm going to also add the words equity and inclusion but those 3 words really mean something to us. And I think you've heard it as a theme throughout the night. And it means something to us across all levels within the organization. And we're really intentional about our actions. So some of the way that our leaders have demonstrated this is we have very clear policies. We have dedicated leadership development programs, trainings, 12 different ERG groups, HR metrics with clear action plans, and much, much more. I think I can even take a moment to share a couple of different examples to bring some of this to life. I would say, first and foremost, from an interview perspective, we have a very structured interview process where we are very deliberate about making sure we have diverse slates for all of our open positions. We also ensure that we have a diverse interview panel as well, creating the best opportunity for the candidates to go through the interview process. Another one that I'll highlight really quickly is that for large team meetings, we often designate someone called a DE&I observer. So it's someone that kind of observes the team on certain dimensions of DE&I as we go through the team meeting. And at the end, we create an open space where we have a conversation of, hey, what worked well? And what are some opportunities where we as an organization or a team can continue to grow and develop? And then lastly, I would close out with talking about the Credo. So Credo is another theme that you've seen throughout the night. But every year we publish a Credo survey, and we really encourage every single person within our organization to take that Credo survey. It's an anonymous survey, but we want people's voice to be heard. And once we get those results, we take them very seriously. And that's where Nima talked about the Credo team. We have Credo teams that look at those results and really create deliberate action plans to address the feedback we get. And the Credo survey, is a big component of measuring how well we're doing in terms of DE&I as well. So very, very strong commitment from our leadership when it comes to DE&I. And I'm proud to be part of the company.
Thank you, Jackie. That was a perfect response. Thank you so much. I think you definitely showed us how you all are dedicated and committed to the DEI efforts and diversity efforts at your company. So thank you so much for that.
Of course.
Tam, are you here?
Totally. Hi.
All right. Hey, good to check in with you again. So we have a question for you. And that question is, what advice would you have for someone who's coming new to the organization?
Larry, thanks for the question. It's quite fitting since I feel like it was yesterday that I just joined. I'm going to approach this one from 2 different angles. One angle or one perspective would be, what are some of the things you can do before you join the company? And then second angle or perspective is, what can you expect once you show up on day one? What does that look like? I'm going to unpack that a little bit. So from the before perspective, you want to get to learn the company you're joining. You go onto our website, it's going to give you newsletters that are popping up as far as what we're doing today, what our vision. You look at our annual report, it paints the picture of what's important to J&J and what we want to do in the future. And then the just learning about the company. The second component that I want to talk about is the industry. You want to understand the industry. Who are our competitors? What are our competitors doing and why are they doing it? And then finally, I'm going to touch on the culture. You want to also understand the culture. Doppel, Kimberly, everyone has pretty much talked about, walking in and visiting a site or an office, networking. But our credo really speaks to our culture at J&J. Those 4 stakeholders, it is true and living. It is breathing. Being new to the company, I feel it every single day. I can show up as my authentic self without question. So that's the before. And a lot of that you're going to be doing before you even apply, but you continue to build upon that, right? So now you are here and you're going to start maybe tomorrow. Tomorrow's your first day. What can you expect and what can you do to really do when you first start out to make this a seamless experience? 3 components, I would say. The first one is going to be the onboarding. So what are those basic functional requirements you need to be the best at your job and just to be able to do it? Second component, I would say, is the training. How do you build and grow as an individual? We talked about some developmental programs. And then finally, community, because that's truly important, right? We're a relationship company. It's about community and building. So from an onboarding perspective, we have checklists. Provides you with day one, week one, your 90 days. So on day one, did you set up your technology? Here's a link, here's a phone number to call if you're having problems. Week one, did you set up a cadence with your manager? Are you checking in with your manager and your team? How are you building that out? Go fast forward 60 days. Have you built your goals and objectives? It's just a checklist to ensure that you are culturally aware of what's expected at J&J and that you're not behind in any way, shape, or form. Because again, how we develop and progress as leaders is truly important, and we want to make sure that's fair and equitable across the board. From a training perspective, we have a plethora of resources. We have our J&J Learn platform where you can choose whether it be an exposure, an experience, or just development period that you want to get into, and you can select from there. We have J&J supply chain. So coming in new from 20 years in the Navy, working across supply chain and finance, I wanted to understand what J&J supply chain was like. We have our end-to-end supply chain training that you can go through to understand how Janssen does supply chain. Being a supply chain person, I also wanted to understand life cycle management. So I could go and look at our drug development process and the life cycle, plethora of training that you can dive into. And so speaking to those, that's high level. What about some of those like tasks that you have to complete to do your job? We have job aids. I mean, I cannot emphasize enough how many different resources we have for training and just to ensure that you're successful in your role. And then finally, community. Jaggy touched on the ERGs. I would say for community, you're going to build your circle of trust. You're going to reach out to mentors and advisors. You're going to build that along the journey, and you have the ERGs. Our ERGs are voluntary, employee-led, and developed work groups of shared interests, affinities, and experiences. And you can get your advisors and your mentors through your ERG. You can also get it through your one-on-ones with people, again, relationship-based. And you can get your mentors that way too. But the ERGs, not only are they a group for you to have your common interests and share with each other, the ERGs also get to drive and shape what we do for like DE&I, for example, and inclusiveness at the company. So phenomenal team and company. And I'll cut it short because I know we're running short on time, but that's
Pam,
my advice.
Thank you so much. Thank you for your service as well. Thank you for your response. I think you brought a lot of light to exactly what we're talking about here today, and the candidates have really benefited from your answers. So thank you so much. I think at this point, we're going to move on. We're going to thank our panelists. First of all, this has been great. We are going to go into our breakout sessions. Our breakout sessions will consist of a subject matter expert from Janssen. We'll have a talent acquisitions personnel person in your room, in your breakout room. You have an HR support person. You'll also have an HBCU CONNECT person there, right? So we will have enough people there to support you. So we're going to start breaking out the rooms. You should have already, you should know as a candidate which room you're going to, but just to help you out, if you're going to an MSAT room and your last name is A through L, so apple through leopard, then you're going to go to room 1. If your last name starts with M through Z, that's Madison through Zebra, room 2. For process engineering professionals, if your last name starts A through L, apple through leopard, then you will go to engineering room 1. And if it's M through Z, engineering room 2. Our digital technology strategy professionals, you will be able to go to the digital breakout room, and we will have our Janssen, our HR and talent acquisition folks, as well as HBCU CONNECT there to kind of help facilitate the room. All right, definitely use the chat, use the open hand feature, raise hand, and we'll see you soon.
Yep. If anybody needs help getting into a breakout room, I'll hang out here for a few minutes to help folks get into the rooms. But you should have in your email which room you were designated to jump into. But let us know if you need any help. Now, once you get in the breakout rooms, you can also turn on your video if you're in a place where you can do so, and use the raise hand feature to ask questions and take advantage.
Perfect. Thank you, Will.
Hey, Will, this is Jim Breen. Where is the link to go to the breakout room?
So it's in Zoom. There's a feature called breakout rooms. Let me see here if I see your name.
Breakout rooms?
Yes, it's a feature within Zoom. Click on that and it'll show you the list of breakout rooms.
Will,
And
this
then
is, sorry.
How do we get to ours? We just hit join?
Yeah, if you
Yeah.
click on your name and then the breakout room that you're going to.
Okay, thank you.
Mhm.
Hi there. I'm looking at the email, but I don't see the link for the breakout room.
It's the name of the breakout room in the email. Do you see the name of the breakout room?
I see MSAT room 1, which is where I want to go, but I don't see where I'm supposed to click a link.
Okay, so it's in Zoom. So if you look at the control panel for Zoom, there's an option for breakout rooms.
Okay,
You just click on that and then choose the room.
perfect. Thank you so much.
No problem.
Hey, quick
Hey,
question.
hey.
This is, hey,
No,
sorry.
This is Jim Breen. I'm leading the breakout room. I don't see how to get there. I go to breakout rooms and I don't see my name in the rooms.
Can we assign Jim, assign him to 1?
Oh, wait a minute. Now I see it, Barbara. Sorry, my apologies.
Yeah.
Okay,
Mhm.
my
Scrolling
apologies.
down.
Yep.
No worries.
Quick question, Norm Henry here. If we wanted to touch both breakout rooms, MSNT and engineering, how do we do that?
You can jump into the rooms yourself. So
Okay.
I would recommend you going into the first room. That's where we have designated, and expect you.
Yes.
And you can jump into the other room after.
Very well. Thank you.
Sure.
And you can also, just want to let you know that the TA partner, you can send them a chat while you're in the room to let them know that you're interested in the other one, in case you're excited about the conversation you're in the moment and don't want to transition. And we'll
Got
be
it.
sure to consider you for both roles.
I think we have a problem. Somebody closed the rooms.
Okay.
Our breakout rooms are closed for 41 seconds.
Okay. So our co-hosts have the ability to close the room. So somebody must have done that by accident. All right. So we're
Oh
gonna
no.
and we'll reopen the rooms. No worries. So everybody.
Guys, remind me again, where do you get to this breakout room? I went to the wrong room.
So you'll see an option for breakout rooms on Zoom, but we're gonna have to reopen the rooms in 10 seconds here. I think someone accidentally hit the close from our co-host list.
So I don't see, this is Norm Henry again. I don't see my name in the breakout room that I'm listed in.
Right. I think someone accidentally clicked close
Yeah,
all
yeah.
breakout rooms.
Yeah. I'm gonna open them back up.
Everybody's gonna get dumped back in here.
Okay, so everybody who just came back in here, so to our Johnson and Johnson folks, you all are co-hosts, so please don't close the rooms. Don't hit the close room button for the breakout rooms. Now I'm gonna open the rooms back up. Actually, it looks like somebody already did that. So you all can jump back into the rooms. If you need help, just let us know. We'll help get you into the room. But if you're a co-host on the Janssen and Janssen team, or even the HBCU Connect team, don't close the rooms. Thank you.
I will. This is David. What breakout room am I in?
It should have been in your email that I sent you with the invite and the link to the meeting.
Okay.
Hit it again.
Yes. Hi. My name is Rowan. I have a similar question. I saw in my email the MSAT room 1 and 2. That means I go into the MSAT room specifically, because I just see 4 different options there.
Yeah, there's 2 MSAT rooms. So based on your
Okay.
last name, based on the first letter of your last name.
And how do I get back into the room? It's not on my screen anymore to click into the room.
We'll open it back up here in a second.
All right, thank you.
Hi, this is Carissa. I just got kicked out of my room as I was doing my introduction. So I'm supposed to be the SME for the digital. I don't know if someone can, shoot me back in there because it doesn't look like I can.
Yep, we're gonna do that right now. So
Thank you.
one of our co-hosts accidentally closed the rooms.
Thank
Let me take the co-host permission.
Hey, I was just kicked out of my room. Do you know where I'm supposed to be then?
You should be able to jump back in now. Sorry about that. Someone accidentally hit the closed room.
Yeah, for the co-host, if you want to remove that breakout rooms window, just click the X button in the top right and not the close all rooms red button. Then that'll get rid of the box.
Hey, Reg, we did that and I'm still getting a timer. It says it closes within 40 seconds.
Yeah, because someone else had closed it out. Someone else
okay.
pressed the button.
You can go
Gotcha.
back.
Hey, HBCU team, can you just confirm that the rooms were not created to just be live for a minute? I just got that note from someone.
Okay, yeah, I can double check that.
Yeah.
Is there a way to quickly remove all the other co-hosts?
That's what I'm looking for right now.
We're sending notes right now, hands off of.
Everybody put their hands up. Just-
Should I go back to my room?
Yes.
Okay.
Okay. So the folks that are still in the main lobby, if you need help getting into a breakout room, let me know.
Okay, this is David. I'm going to digital breakout room. How do I get there?
I got you.
Okay, thank you.
No problem. LJ, if you want to jump into, I think it was MSAT 1.
Yeah, I don't see my name to jump over.
Your name?
Yeah, I was trying to just click into MSAT 1.
Oh, you don't see the MSAT 1? I got you.
Okay, got it.
All right.
And for the healthcare. So we want to thank you for that. And I think, Larry, that was really, please make sure you're taking a minute for the QR code, but I know there will be some follow-up. We look forward to continued connection. And Larry, I'll turn it back over to you.
Thank you, Barbara. You said a mouthful there, but I think what resounded was that the credo is everything at Janssen and Johnson. It's the culture, and it's where the business is and where it's going. I love it. I think we've had a lot of notable people on the call today. So thank you for everyone who was involved with setting this up. I know it's not easy to get that level of talent all in one place. As we said, there were people around the globe. There's people, out the country, but they took the time for this event. To our candidates, thank you for coming out. We couldn't do it without you, but don't miss out on the opportunity. If they've given you a QR code, if they've given you a link, make sure you're taking advantage of it. Keep in contact with the representatives you've met tonight, this evening. We'd like to hear some success stories. There's nothing better than hearing that we've put together an event such as this, and then you got hired. And from there, a new career is spawned, and that's what we want to hear. So to everyone there, thank you. I will turn it over to Will, our founder and CEO of HBCU Connect, see if he has any last words, and we will close us out.
No, I appreciate it, LJ. An awesome job moderating it. To our folks from Janssen and Johnson. Thank you all for partnering with us to present your opportunities to more diverse candidates. Your commitment to diversity, equity, and inclusion is obvious and consistent. To our candidates, we want to thank you all for coming. And so, LJ, if you want to take the slides down, I want to invite our candidates to turn your cameras back on, and let's get a screenshot to remember this event. And the other thing I want to remind people about is that people get hired from these events. So we're not just doing these events as a show and tell and an info session and that's it. No, people are getting hired from these events, specifically with Janssen and Johnson. So the hope is that you all go through the interview process, apply using the link that has been provided. We're going to share your resumes with the Janssen and Johnson team. And but we do want you to also take action. So they'll be able to follow up with you as well if there's a fit. but we want you to take action utilizing the QR codes and the links in the chat. So with that, thank you all. Like I said, to our candidates, if you all did not come, then this would not be possible. So you're setting and paving the road for those that come behind you to take advantage of these opportunities as well. So Louisa, if you're ready, we'll go ahead and get a screenshot of our smiling faces.
Yes.
All right, so I like to do a 3, 2, 1 cheese. So 3, 2, 1 cheese. Got it?
And I think Louisa just put the survey in the chat.
Right, so we'll email the links to you all as well. So we have a follow-up survey, and we want you all to take action if you're interested in a conversation with Janssen or Johnson & Johnson. But again, thank you all. We really appreciate it. And let us know if you land an interview or if you're hired. All right, good evening.
Bye-bye.
Thank you. Have a good evening, everyone.
you.
Take care.
Bye, everyone.
Thank you.
Bye.
Have a good evening.
Bye.
Bye.